Hello, my name is Ezekiel Oburu. I am an orthopedic surgeon at Nairobi Spine and Orthopedic Center, and today I will be talking about one of the conditions that afflicts the thumb, known as Quervains Tenosynovitis. So the big name, Quervains Tenosynovitis, is really from a Swiss surgeon who originally described this. He described 5 patients with a condition in which you have pain in the wrist. So the pain that you have usually involves this side of the wrist or the radial side of the wrist, just really at the base of the thumb. What's the cause of Quervains Tenosynovitis? If you look at your wrist, especially the back side of the wrist, we call it the extensor surface of the wrist. Usually what we have is a number of tendons coming, and there are a number of tendons that come to the thumb, and I'll ask Getty to do this. If you could do this, raise this thumb like this, and you can see this is one of the tendons. It's called the extensor pollicis longus. But then if you look at the thumb over here, we also have 2 tendons. One is called extensor pollicis brevis and the other one is called the abductor pollicis longus. So these 2 tendons, they pass through a sheath, and sometimes that gets swollen and the tendons get almost like narrowed or jammed in that tunnel that they pass through. So these patients will complain of a lot of pain in this area. Usually this is quite commonly found, especially with mothers who are nursing children, and they say that they find it very difficult to carry their children, or even in nursery workers, sometimes even in ladies who are pregnant, you may get this, just like you may also get carpal tunnel. So what are some of the things that we do when we see a patient? One of the things that we do is we try to feel this area, and we find that they may be having quite a bit of swelling here, sometimes a bit of pain. One of the other things that we do is we do what is known as a Finkelstein's test, and this we tell the patient to hold their hand like that, and then we just gently do that. You can see that when I do this to get his hand, she doesn't feel any pain, but any patient with Quervains Tenosynovitis will not allow me to do that. So what are the options with regards to treatment? One option sometimes we do is we give a wrist brace with a thumb extension, and that will allow the tendons to rest, give them time to heal. So that's one option. The other option that we do is we give a steroid injection, and what I essentially do is I inject into the tendon sheath of the tendons. So and that usually resolves most of the time, it resolves it completely. If that does not work completely, then the only other option is a surgical option, where you release the tendons over here with a small incision. We're careful because there's a nerve that passes there, so we're very careful to protect that nerve, but you release it with a small incision, and that should sort out the problem. Thank you very much.